Okay, so I'm running in the election because when I worked as a public librarian at the St. John Free Public Library, I saw a lot of patrons whose voices and values weren't being heard or listened to by the current government or the past government. And for me, I want to uplift my community, and I want to ensure that all the voices are being heard in my community, and that everyone in my community is contributing to shaping our future. Yeah, so I do live in my riding, and I worked in my riding. I don't work anymore. I'm unemployed. I'm a student now, so because of the school I go to, it's that school outside of my riding. But when I worked in my riding, I saw a lot of injustice, and I saw a lot of I just saw a lot of people, like I said, I just saw a lot of people who kind of weren't being listened to and were kind of being left behind. A lot of people, like just through my experience at the library, it seemed like they didn't really care about politics. And I think that really stems down to like they were just constantly being let down by the government, having to jump through these hoops to do things like find housing or kind of like get their way out of poverty. For like in my riding, we have the highest child poverty rate. So I think it's just like things like this. A large part of the community in my riding is just constantly being let down by the government. So I think in terms of that, they just didn't see the value. They don't see the value in getting involved because they don't trust the system, I guess. And I think for me, that's disappointing to see, because I feel like everyone in my community should feel that they can get involved and should feel that like their voice matters. But I think through my experience, it wasn't like that at all. Yeah, so I actually grew up in a different province. I am from St. John, and so I have a unique experience in that I've seen kind of a different experience in a different province. And for that, I come here and, we pay some of the highest taxes, and we're not getting the same quality of life, I guess, that they're getting in other places where they're paying less taxes. And I know there's more people in those places and it's different. But I feel like here, it just seems like the system is a little bit more corrupt, and it seems like it's working more against people rather than for people. Yeah, so I'm a student at the university, and I'm studying education. So I'm kind of doing a deep dive into the curriculum system here to understand kind of like what students are learning in terms of information literacy skills. So that's definitely been eye-opening to see that there's kind of a huge gap there, particularly in digital literacy and information literacy. As well, my mom was actually a teen parent, and she's from St. John, from the Old North End. I grew up in poverty. So for me, that experience, I guess I don't want any other child to have to go through what I went through when I, grew up with a single parent living in poverty. As a librarian, a public librarian, and even actually at the university when I worked as an academic librarian there, I see a lot of students who are in like crippling debt, who can't afford to eat, who are at the university all day, every day without food. So that, and like, they're exhausted, they're tired, they're constantly worrying about how they're going to pay for next semester or how they're going to pay for their rent. Like that has been pretty eye-opening for me. And then as well as the other side of it at the public library, where I'm working with more of like the general public, just seeing how like let down people are. Like people just seem so depressed and kind of like there's no hope left, that the system really is kind of beating them down. And oftentimes people would just tell me, oh, well, that's just the way it is here. But it doesn't have to be like that. Sorry, that was a little bit longer. So number one would be tax reform and municipal reform. That's a huge issue in New Brunswick in general. I mean, obviously it's a huge issue in St. John because the city is broke, but it definitely is. It affects kind of every part of New Brunswick. I mean, the rich keep getting richer and the poor keep getting poorer, and it's definitely seen in St. John Harbour. My next one would be access to healthcare. I care about Clinic 554. I advocate for Clinic 554. I want to see that service paid for, and I want to see that service extended across New Brunswick, as well as other services like primary care. We need to really put money and focus and energy into primary care to have more family doctors and more nurse practitioners available to people here. The next one would be education. So the community hub and learning commons that the South End is trying to get developed. St. John and Living St. John are actually trying to get funding for by the provincial government. That's a huge priority for me. We haven't had a new school in 40 years, 40 years. So it's more than just a school, it's wraparound services, and that's definitely something in a place where we have like the highest child poverty that's 100% needed to kind of uplift this riding. I would say the other one is affordable housing. Affordable mixed income housing is super important. I want to work with people like Dr. Julia Woodhall-Melnick and Dr. Eric Wiseman, who specialize in this area at the university, and they have a lot of good ideas and good research in terms of changing the policy, like the double taxation, and different things around that to I guess, change the way that the system is working in St. John Harbour. And I would say the last thing would be transit. Transit is important for for everyone, really. Like, even if you have a car. I mean, I have 2 cars, and I wish I didn't have any car. But it's really hard to get around in New Brunswick and St. John without one. If you need to be constantly driving outside the city, or if you have multiple jobs and you need to get from one job to the next, like, the transit system's not good because it's not properly funded here. And I really think that transit shouldn't cost anything. It should be free. That should be covered by the provincial government, especially after COVID, after so many people kind of got let go and had like financial difficulties there. We need to focus on being able to get people back up onto their feet. Okay, so you just want me to say like what I think about it and then how to fix it? Okay. Sorry, I didn't know if you're going to ask the full question or not. Okay, so for reproductive, so I mean, the first thing, I don't want to say obviously, because Blaine Higgs clearly doesn't see the obviousness in it, but repealing 8420 would be the biggest thing, the main priority that needs to go. And on top of that, working with the New Brunswick Medical Society and the healthcare workers in the city. So I know that even if and when 8420 gets axed, there are still a lot of barriers that need to be addressed. So, for example, the way that the billing system works in New Brunswick with like the medical billing system. I don't know like a lot about that because I'm not a healthcare professional, but I know that it's an issue and it needs to be addressed just based on my conversations with the New Brunswick Medical Society. As well as, so when 8420 gets axed, who's going to pay for that equipment in the family practice offices? Because the equipment in the hospitals is currently being paid for mostly by the government, but in a family practice office, there's currently no like policy or anything that holds the government to having to pay for that equipment. So when you provide an abortion, you need to have ultrasound equipment, and if the government's not going to pay for that, then that falls onto the family practitioner to pay for that. So I think it's definitely a complicated issue in terms of reproductive health. We need to be working with the medical society. I know that they recently released kind of an ask or like their demands for the incoming government. So I think it's important to work alongside them in terms of these issues rather than kind of pretending that how this is going to work. Because like I said, like I'm not a healthcare person, so I don't have all the answers, and I don't work in that field, but they do. So for me, it would be really important to work alongside them. And also on that note is in terms of educating doctors on LGBTQ plus health, that's a huge issue. So the system, like their system is kind of flawed in that a doctor technically never has to learn anything about LGBTQ plus health. So they do have to take continuing education credits every year, a certain number, but they get to choose what they want to take. There's no mandatory course or subject that they have to take or learn about. So technically a doctor could go, like I said, 50 years and never have to learn about LGBTQ plus health. So I think that in itself needs to be addressed. That's an issue that needs to be addressed with the College of Physicians and Doctors, because they kind of control / like mandate that. So kind of making sure we're holding those doctors accountable. Like I asked my family doctor, like, what are you doing to learn about LGBTQ plus health? What are you doing to learn about like Black people? Because, you know, those symptoms are different on that skin tone than white skin tone. So yeah, it's definitely a complicated issue that we would have to work alongside the medical societies and the College of Physicians and Doctors with. Sorry, that was kind of a long answer, but it's I know it's a huge topic. Yeah, so I think that those, and I believe this is in the NDP platform as well. That service needs to be covered by Medicare. That's the first barrier, is that it's not covered by Medicare. So, you know, for both myself and my spouse, we pay, I think each we pay $200 a month, so $400 a month for like therapy and counseling, and that needs to be covered by Medicare. That's ridiculous that anyone has to pay that much to take care of their mental health. I mean, mental health is just as important as physical health. So definitely that. And I think like making sure we're doing a better job at recruiting these people, these professionals into the province. So I know that there are, so like, for example, my therapist has, like, she needs to take more people in. Like, she's told me, if you know anyone who needs counseling, let me know. But the problem is that people can't afford it. So I think we need to kind of figure that out and pay for that service for people. I know that Family Plus offers a what's it called, like a sliding scale model, where they charge based on kind of what you can afford. But, you know, a lot of people don't know about that. And also, I don't know, I feel like some people feel like, oh, well, you know, I should be able to pay the full price like everybody else. So they either don't go and see it or they don't take advantage of that service. But yeah, it definitely needs to be covered by the government fully. And I think that would help people like going to see counselors, because you don't need to go to the Mercantile Center. You can just go to a counselor or a therapist in the city instead. Okay, but that's what I thought I heard. Yeah, so for that, we need to stop using it. We need to stop spraying. We need to, you know, stop hurting our environment in the way that we are. We only have one Earth, and we need to take care of it the best we can. So, I mean, this is a subject that I don't know a lot about, because it's not something I study every day. I work in education. I don't work in like environment. So for me, it would be, again, working with the professionals on this topic. I know there are a lot of we're lucky in that, you know, in New Brunswick we have academics, and we have a few universities and environmental specialists that we can lean on to help us with these issues. I think for me, that's definitely what I would be doing, is educating myself through consulting the professionals and what we can do to get away from this, from spraying on the province. Yeah, so access to affordable housing. So I think it's more about the, sorry, I'm just flipping through my notes here because I addressed this yesterday. It's about mixed income housing is really important, and it's a model that they use in a lot of other places in Ontario. So for something like this, we have specialists that are literally like in St. John who are working on this issue. So Dr. Julia Woodhull-Melnick and Dr. Eric Wiseman, I think I mentioned them before. They specialize in homelessness and housing. Julia Woodhull-Melnick worked with Dr. Jim Dunn, who's a Canadian Institute Health Research Chair in Ontario, and you know, him and his team in Hamilton have been doing a lot of work around affordable mixed income housing. So we should be kind of looking at those models and the work that they've done to, I guess, implement that here in St. John. The double taxation needs to go. That That's a huge barrier as well for the province. I know that Dr. Eric Wiseman has been working on tiny homes, which is a really interesting concept that we could introduce in St. John and in New Brunswick in general, to help get people off the streets and to help provide people with homes. But I really do think that the answer would be the mixed income housing. People, like, landlords are so skeptical about it because they think that, oh, when they take someone in who's homeless, they're not going to pay their rent, or they're going to cause problems, or kind of like mess up the apartment or whatever. But we know from research that it's actually better to have somebody in your apartment building that experiences homelessness, because when they receive their government funding for their housing, that money automatically goes to the landlord. So you're guaranteed your like the rent from that person, rather than, a working individual who might, lose their job or something might come up. So yeah, I think definitely mixed income housing is really important and something that we need to look into and implement here in the Harbour and in New Brunswick. Yeah, so I am definitely pro defund the police, but I think it's more than that. So obviously, like, police need more training for sure. Like, they need more mental health training and more training in those areas that they're not getting from their courses at Holland College or wherever else they might take that if they go to Ontario or something. So they definitely need more training there and more support there. But I think it's about taking money from the police budget and spending it on more social services. I was talking to Donna Reardon about this, who told me that, they need police officers in her area because there's drug issues and kind of vandalism issues. But if these people had better support in social services, we know from research that the vandalism and the drug use and that would be lower. So we definitely need to give the police more training and support in that way, but also we need to take money from I think it's like 26 million or something that they have, take money from that and put it into other social services. So I think that kind of falls in line with, like, the more training for police officers. It's tricky because, personally, I think that when you report something like this, it should be reported to the police, but also like the sexual health center or something like that, like somewhere, like a specialist that knows more about these issues than the police would. So kind of including this organization in those reports, I think, would help with that issue. I don't know, like, a lot about the back end about how that would work. Like, I don't have a solution for how that would work, but I would like to see kind of the sexual health center or, some sort of other body similar to that work with these individuals who are reporting, as well as the police, so that we can guarantee that these reports are being dealt with in a appropriate way. I think it's kind of foolish that we're only relying on the police to deal with this, where, they don't really have that in-depth experience working with sexual assault survivors or sexual assault victims. Yeah, so I think it needs to be done. We need to tax the rich, or the Irvings or the McCains or whoever you want to label as the rich, and give that money back into social services, back into the nonprofits, back into the community partners, back into transit. I think I had said earlier, like, the rich in the city keep getting richer and the poor keep getting poorer. And, it doesn't need to be like that. We need to kind of comprehensively reevaluate how taxes and how municipal reform is looked at in our city. I met with John Darling and talked to him about his, I forget the name of the document, but the document that he had released to the candidates that are running. And I think it's important to work alongside the city and make sure that taxes are staying in St. John, and not only staying in St. John, but being used in a way that benefits, the people at the bottom. So we should be taking care of the people at the bottom first. rather than kind of giving these organizations tax breaks and what's the name? Oh my gosh, I forget the tax breaks that the Irving building got uptown. Like stuff like that needs to stop. Yeah. Yeah, so for St. John Transit, so I actually went to the rally, the St. John Transit rally recently, and I was talking to the union rep there, and he had informed me that the commission that the city has for transit is actually ending, and that the city is taking over transit completely now. And that just puts more of a burden on the city. So I do think that transit needs to be funded by the provincial government. I'm really disappointed that Blaine Higgs didn't take the money from the federal government to help support transit after COVID. I think that transit should be free. I think that it should be better than what it is now. We need more routes, more buses, and also more out of city buses as well. So like the Comex, for example, needs to run more often, needs to run later. So I think for that, it's a matter of, I guess, I don't want to take that service completely away from the city. Like I obviously want them to have a voice in that service, but I think that the government needs to play a bigger role, particularly in funding it and in supporting transit in not just St. John, but in every city in New Brunswick. Yeah, so that's actually in the NDP platform. We support universally funded childcare. It's really important. We know from research and from past experiences that oftentimes when a parent has to stay home because of COVID or for whatever other reason, it's oftentimes the mother. So women are having to stay home with kids and not able to go back to work. So we need to ensure that if and when both parents or both caregivers or one caregiver, depending on the situation, decide to go back to work, that they can go back to work worry-free without having to stress about how they're going to pay for childcare throughout the day. And then on top of that, how they're going to buy food and how they're going to buy clothes and all that kind of stuff. We need to make sure that parents and caregivers can go back to work worry-free and that their kids are being taken care of and that the government's doing their part in funding childcare. It's so expensive in New Brunswick. Yeah, so this is something as a librarian that I really care about because I think that information, all information should be open and free to all people. I think for media ownership, it's just a way. So we know from my field, from librarianship, that this is a way to kind of keep information from people or kind of, I don't want to use this word, but it's basically a way to dumb down the system. So when media is owned by one particular organization, such as Irving, it's a way to control the narrative in an entire province, which is our situation right now. So the news that our grandparents get and our parents and even maybe friends are getting is right from Irving. It's obviously biased. We need to do a better job at teaching people about information literacy, which is something that I care about, so that when people are reading the newspaper, they know that it's being funded by Irving. It's being written by X person, and X person has, published this or published that. I don't want to get into specifics, but I mean, it's the same in research. When an article or a research project is funded by Big Pharma, that research might be biased because of who funded the project. So it's the same for media ownership and for news as well. You need to know kind of more about who's writing the article, where it's coming from, where it's being published, or what paper it's being published in, to understand that this information or how this information might be biased. I don't know what the answer would be to end that. I know that BNI has been taken to court a few times now to end this media ownership. So like, I don't know what the answer is to ending that, but it definitely needs to stop. I don't support the media ownership here, and I think it's hurting our province more than helping.